In this video, we will be looking at cardiac output, its definition, and some of the factors that affect the cardiac output. Cardiac output, by definition, is the amount of blood pumped by each ventricle in 1 minute. The right ventricle will pump the blood into pulmonary circulation, and left ventricle will pump the blood in systemic circulation. So both these events will occur simultaneously because both ventricles will contract at the same time. Now cardiac output is calculated by multiplying stroke volume and heart rate. Stroke volume is the amount of blood ejected by each ventricle during each contraction. So cardiac output equation is CO, which is cardiac output, equals to SV, which is stroke volume, times HR, which is heart rate. Now if the stroke volume is 80 milliliters and if the heart rate at rest is 70 per minute, then the cardiac output will be 80 times 70, which is 5600 milliliters per minute. This is cardiac output of an average adult. Now, why is it important that the cardiac output must be regulated precisely? Because the cardiac output ensures that all the tissues will receive adequate blood supply all the time. So that's why the cardiac output must be regulated within that range. Now several factors affect the cardiac output. Some will alter heart rate, some will alter stroke volume. Now here is a summary of the factors that we will be looking at. Some of the factors we will see in detail. Factors affecting heart rate are autonomic innervation, hormones, fitness levels, age. Factors affecting stroke volume are heart size, fitness level, gender, contractility, preload and afterload. Now let's see the factors affecting the heart rate. Blood volume reflexes, autonomic innervation, emotional states and hormones. Blood volume reflexes are automatic responses by the heart to the changes that occur in the blood volume. The change in the cardiac output is brought about by either altering the heart rate or by the stroke volume. There are two blood volume reflexes: atrial reflex, also known as Bain bridge reflex. This reflex affects the heart rate. Another one is ventricular reflex, which affects stroke volume. Let's take a look at atrial reflex. This occurs in right atrium, and what it does is it adjusts the heart rate in response to the change in the venous return. So let's say for some reason venous return is increased. The right atrium, the wall will be stretched. Now because there is a stretch in the atrial wall, that will cause stimulation of stretch receptors. This stimulation activates sympathetic system and SA node activity. You remember SA node, which is responsible for generating heartbeat impulse. So this SA node will increase the heart rate. So this is atrial reflex. Ventricular reflex talks about ventricle and the stroke volume. When more blood enters the ventricles will respond by contracting stronger. So please note here, the reflex is not about rate, it is about the force of contraction. So because of higher force of contraction, the amount of blood ejected out from the ventricle in one contraction will increase. That means, in simple words, this reflex causes increase in the stroke volume. Now, this reflex was described by two physiologists, Frank and Starling, and hence it is called as Frank-Starling's law of the heart. So, what does this law say? Their actual law states that the energy of contraction is proportional to the initial length of cardiac muscle. This sounds a bit confusing. In simple words, more blood in, more blood out for ventricles. So in simple words is, the more blood is put in the heart will contract harder to push that blood out. Autonomic nervous system, which influences the cardiac output either by altering the heart rate or stroke volume or both. There are two parts of autonomic nervous system: sympathetic system and parasympathetic system. So sympathetic system, which is active during stress, also known as stress response, this system releases epinephrine and norepinephrine. These hormones causes increase in the heart rate and increase in the stroke volume. Parasympathetic system, which is also known as rest and digest, this system releases acetylcholine, and acetylcholine causes decrease in the stroke volume and decrease in the heart rate. Another area that is cardiac centers. Now these cardiac centers are located in the medulla oblongata and they control the autonomic activity of the heart. Now there are two cardiac centers side by side. One is called as cardio-acceleratory center, and acceleratory means faster. So this cardio-acceleratory center activates sympathetic system, which will cause increase in the heart rate and stroke volume. Cardio-inhibitory center, which is very close to cardio-acceleratory center, this activates parasympathetic system. So inhibitory means slower. Because of this, the heart rate reduces and the stroke volume reduces. So these two centers will affect the cardiac output. In this diagram, you can see the sagittal section of the brain showing you two yellow dots of cardiac center. So the cardio-acceleratory center will activate sympathetic system to increase the heart rate and stroke volume. Cardio-inhibitory center will activate parasympathetic system, which in this case is vagus nerve, which decreases the heart rate. Emotional state also affects our cardiac centers. Example is rage, anger, fear. All these emotions, they cause increase in the heart rate, whereas satiety causes decrease in the heart rate. Hormones such as thyroid hormones and glucagon, they increase the cardiac output. Let's see the factors that affect stroke volume. So here we need to look at three factors which will affect stroke volume: preload, contractility and afterload. Preload depends on the venous return and the ventricular filling time. So venous return is the amount of blood returning to either atrium. So in right atrium, the blood will be returning from the body. In the left atrium, the blood will be returning from the lungs. Ventricular filling time directly relates to ventricular diastole. So ventricular diastole is the relaxation of ventricles during which the filling takes place. You can refer back to cardiac cycle video. Contractility is the force of contraction of the myocardium, and this force actually determines the stroke volume. Now, the contractility of the heart is affected by autonomic innervation, which is our sympathetic and parasympathetic, and hormones. Now, under pharmacology, you will study pharmaceutical agents or the medications that influences the contractility of the myocardium. These are called as ionotropic agents. So, positive ionotropic agents will increase the contractility. Negative ionotropic agents will decrease the contractility of the heart. Afterload is the tension both ventricles must develop to pump blood effectively against the resistance in the vascular system, which is arteries. So the left ventricle has to pump blood in the aorta, which is the high resistance vascular system. Right ventricle has to pump blood into the pulmonary trunk, which is low resistance vascular system. Now, afterload depends on the blood pressure in either circulation. So, when I say either circulation, it means pulmonary circulation for the right ventricle and systemic circulation for the left ventricle. Afterload also depends on the status of the semilunar valves, which is pulmonary valve in case of right ventricle and aortic valve in case of left ventricle. Now, there are drugs that cause vasodilation or vasoconstriction of the arteries. Vaso is blood vessel, dilation is increase in diameter. Vasoconstriction is decrease in the diameter. So these drugs, these medications which affects the diameter of the blood vessel will affect the afterload. You will study these vasodilators under the pharmacology of antihypertensive drugs. This diagram shows you all the factors that affect cardiac output. So cardiac output equals to heart rate times stroke volume. Heart rate is affected by atrial reflex, autonomic innervation and hormones. Stroke volume is affected by preload, contractility and afterload. Preload is affected by venous return and filling time. Hormones and autonomic innervation affects contractility and afterload is affected by vasodilation and vasoconstriction of the blood vessels. Thank you for watching this video.